Hello again. My name is Amanda Sheridan and I'm going to be presenting on PID, also known as pelvic inflammatory disease. So, what is pelvic inflammatory disease? Pelvic inflammatory disease is an infection of a woman's reproductive organs. It is a complication often caused by some STDs like chlamydia and gonorrhea. Other infections that are not sexually transmitted can also cause PID. For example, douching, which can allow bacteria to travel up the vagina, into the uterus, fallopian tubes, etc. How do I get PID? Like I just mentioned, you're more likely to get PID. One way is douching. If you have an untreated STD, if you have more than one sexual partner, if your sexual partner has more than one sexual partner, if you have had PID before, that increases your chances of getting it again. If you're under the age of 25 and sexually active without using the appropriate protection, even if you have an IUD, which is an intrauterine device for birth control, although I did read that the risk is mainly limited to the first 3 weeks after the implantation. So how can I reduce my risk of getting PID? Well, the only way to completely avoid an STD is to not have any vaginal, anal, or oral sex. If you are any kind of sexually active, being in a long-term monogamous relationship with someone who is also negative for STDs and or using common condoms correctly can definitely lower your chances of getting PID. Some signs and symptoms. How do I know if I have PID? There are no tests for PID. A diagnosis is usually based on a combination of your medical history, physical exam, and other potential test results. You may not realize you have PID because your symptoms may be very mild or you may not even have any symptoms at all. But if you do have symptoms, here are a few things you may notice. Pain in your lower abdomen, fever, unusual discharge with bad odor from your vagina, pain and or bleeding when you have sex, burning sensation when you urinate, and even possibly bleeding between periods as well. And if you notice any kinds of these symptoms, you should definitely be examined by your doctor immediately. Can PID be cured? If it's diagnosed early enough, it can be treated, definitely. However, the treatment won't undo any damage that's already been done. The longer you wait to get treated, the more complications you will have. Even if the symptoms go away, you need to continue any medication that was prescribed to you. It would also be smart to tell your partner so they can get treated as well. It is very important that you and your partner, if you were to both have to be taking any kind of medication, both finish all treatment before having sex again so you don't reinfect each other. Also, you can get PID more than once and have a higher chance of getting it again if you've had it before. I think I already said that like twice. All right, what happens if I don't get treated? Like I said before, if diagnosed and treated in time, the complications of PID can be prevented. If not, some of the complications that you can run into would be formation of scar tissue, both outside and inside the fallopian tubes, that can eventually lead to tubal blockage. Ectopic pregnancy, infertility, and long-term pelvic and abdominal pain are a few things that you may run into. And lastly, who gets PID? Any woman can get pelvic inflammatory disease, but women who have multiple sexual partners and practice unsafe sex are most likely to get an STD that can cause PID. It is also more commonly seen in sexually active women under the age of 25. So that about wraps it up. There is my works cited, and that's it.